my ex, who was one of the perpetrators, that said, I think you need to get help. Something's happened to you. And he was right.
My trauma surgeon, she said, you know, Geraldine, I recommend that all my trauma patients get counseling for PTSD. And immediately I kind of shook my head. And I didn't think that applied to me, but I knew I had to try something.
I had gone through, I think, 6 people looking for somebody. What I found to be important, which is the person I ended up working with, was she had the strength to hold my emotional space. And I just opened up and I just let it out.
Sometimes it can be challenging to find a provider that fits with what you need. Sometimes providers, they may not know the treatments that you need in order to get better, or may not match your personality. The right fit is especially important for PTSD treatment because you're going to be talking about the most vulnerable time in your life.
There's a lot of different treatments out there that people use to try to treat PTSD.
Prolonged exposure really focuses on approaching the trauma memory and reminders with your provider and taking your life back from PTSD by approaching and staying with those emotions, coming to a different understanding of how you think about yourself and the world following the trauma.
Cognitive processing therapy sort of does the same thing, but more cognitively. It has people consider their symptoms, consider exactly what happened in the trauma, and challenge these thoughts that they have.
He, I think, was meeting me where I was and what I needed to hear and helping me understand that these symptoms were normal, but I needed to give myself permission and time to heal.
I worked with a somatic psychotherapist. A lot of the work was on a massage table during breath work, feeling the feelings of anxiety, feeling the feelings of fear, feeling the feelings of I don't know, or I'm scared, or what if I really am weak, or any number of things that were just coming up, and we would breathe into them.
EMDR, which is eye movement desensitization reprocessing. Basically, it's a combination of exposure to the trauma memories and also basically movements of the eyes.
And some people poo-hoo it and say there's no merit to it, and maybe that's true, but it worked. Something shifted to where the memories stopped coming back with emotion.
If you don't have access to mental health professionals, one of the best things you can do is reach out to social supports. Find people who you trust, who you can share your experiences with, who you can talk with about what you've been through.
I went on Facebook. I told people I was raped. I think there were, I want to say like 150 to 200 comments from friends all over, and it was positive.
Besides the treatments, there are things that the person can do to help themselves, like lifestyle changes.
I tried to become a student of trauma. I ordered all these books to try to understand why I was feeling this way.
I've been running for years. It was very helpful because I'm not isolating. That running is actually putting me next to people.
I meditate as part of my practice of healing.
A friend had recommended yoga and meditation. At first I dismissed it. I thought, nope, that's not me. But when everything else wasn't enough, I opened my mind to it. And I think that is a key resilience strategy, to be creative, to try something new. And even with all my skepticism, this gentle yoga, these gentle movements, started to give me back this feeling of control over my body that I had been missing.
Even though I had been talking about what had happened with a few therapists, you're still struggling. And so I got all the pills and I put them on my lap. The Late Show with Stephen Colbert was on, and something made me laugh. I couldn't take those pills. I just thought there's still something good in me. And I thought, I'm gonna go out, I'm gonna learn how to talk to people again. I'm gonna go meet people, and on the top of these giant foam boards, I'm gonna put Blake, Late Show. And it'll be a way to say, hey, I'll walk up to a stranger and say, I'm Blake, I'm trying to get on Late Show, can I tell you my story? And that's how it started. At the end of the day, when I would go home, I'd read these boards. It's like reading giant Hallmark cards. People that go through PTSD and depression, we have to find our individual ways, and this was how I found mine.
You can't ask for help incorrectly, but you can not ask for help when you need to. So talk to someone and you start healing from post-traumatic stress.
What did I do to treat my PTSD? It really was no one thing. You know, yes, there was focused counseling. Yes, there were these sort of non-traditional techniques like meditation and breathing and medication. And I really credit all of it together for getting me past that place and helping me find myself again.